there are people who are calling for it to be added to the what they call health insurance treatment. And I've heard Muntaka, for example, say that if care is not taken, yes, we will say it's on health insurance, but if it just was sitting on the health insurance, they will not be able to really give us the results that we're looking for. So, which would you prefer? Reducing taxes, reduces income duties on it, or put it on the NHIS? Which one would you opt for?
David, why would I not go for all? Oliver would always ask for more. Anything that would inure to the benefit of my patients. I mean, yes, I'm going for all. And the discussion as to it being on insurance, I think it's way past, because that is actually what is supposed to be the case. And indeed, we knew some time ago that for these patients who come acutely, and what we are talking about is somebody who is well, who probably gets an accident or gets an infection and comes with an acute damage to the kidney. Ideally, that is on the insurance and is supposed to be taken care of. But guess what? When we present some of these to the authorities, they say, dialysis is expensive, so they don't pay for it. And then over the period of time, then it started getting off, So it is like Motoka is saying, technically it looks like it is on, but it is not on, sort of. So people still are not able to assess it. So I would advocate, and I think the Ghana Kidney Association has been championing this, to try and get, dialysis onto the National Health Insurance Scheme, or some bit of it. I would agree with government that, listen, yes, cost of kidney care is expensive, very expensive. But then, is it possible that we can take some part off, that, listen, if it's going to cost X amount of money, government can waive off, let's say, half, or maybe you need 3 sessions of dialysis. Government can say, okay, we can only take care of 2. And in my last paper, I actually wrote that countries that have similar DPs like us, Kenya, Tanzania, and East Africa, are able to afford some form of dialysis, for their peoples. So the government says, listen, we cannot afford the 3 times. Dialyze their patients who are on insurance twice a week, at least, which I feel it is something that we can also emulate as a country. So we need that discussion, and the Ghana Kidney Association would continue with that, where we would want to say that, listen, we cannot say hands off. If you have malaria, you have diabetes, you have hypertension, okay, it's on insurance. But woe betides you, the moment you get kidney disease, you're on your own. That is not fair. And that sad aspect is the fact that kidney disease is affecting young people, economically active people. Our average age is, let's say, 46, 47 years. And that's the age where people should be working hard to be able to make some money and pay taxes to this government. So government should be interested in getting these people healthy so they can work to pay taxes back to them. I think when we see that as a way to, know that, listen, the people you are spending the money on are people who are valuable so far as, the economy is concerned. So it's not like a waste per se, but it's an investment even in these people. I want the government to look at it that way.
Pray that government